2 years of COVID-19 in the state of Michigan. I'm News 8 Digital anchor Luke Laster here from the Wood TV Live Desk. Ladies and gentlemen, good morning. News 8 Digital reporter Matt Jaworski has put together a series of stories here highlighting the struggles that have been faced due to the pandemic of people throughout West Michigan. Matt, good morning. Thanks for taking some time to chat with us. How are you?
I'm doing great. Thanks for having me on.
Yeah, you betcha. Let's break down these stories. We just had one go live this morning over on woodtv.com. As a matter of fact, that one's attached to the stream, ladies and gentlemen. Take you over to the website. But let's start with the first one. It was titled, In Numbers, 2 Years of COVID-19 in Michigan. Let's go down the list of each of these stories and start with that one.
Yeah, so we really wanted to highlight, in a way, highlighting the 2 years of COVID. So 200 million, more than 200 million total cases. We've lost 32,000 people to the virus now. And we just kind of went spike to spike, kind of measuring where things were at the time. We kind of missed, so nationally there were really four major spikes that kind of defined these first 2 years, at least here in Michigan. Michigan's really only had three. We went into that first, what people call a tight lockdown, shortly after our first cases here. And so for that spring, where a lot of other states were seeing cases spike and their hospitals really overrun, Michigan's case rate stayed relatively low, at least especially here on the west side. You know, the Metro Detroit area dealt with some pretty severe stuff, but here on the west side we stayed relatively low. It wasn't until the fall of 2020 when we sent kids back to school, you know, we were starting to see more signs of people getting frustrated with the mandates and the lockdowns and stuff. That's when we first started to see cases really spike. Actually, so Spectrum Health gave me they dealt with the majority of the cases here, hospitalizations here on the west side of the state. The highest number they had is they had 365 patients at one point in the fall of 2020. That was the highest number they had seen until we got to this Delta Omicron spike here this past fall. And so things petered down from there. And then really Delta Omicron's the big story. Delta really put our hospitals in a tough spot, really pushed them, what they would say, to the brink. Omicron pushed them over it. Obviously the case number jumped dramatically. That's when we really were starting to see thousands and thousands of cases a day. Not as many hospitalizations, but because the hospitals were already so overwhelmed at that point, it really just made everything worse.
And you know what? That was the big focus in this specific story here, was the hospitalizations, especially once Delta and Omicron came, because then we had the vaccine and individuals were just still individuals who weren't vaccinated were filling up those hospitals. How is getting that information and kind of translating that into, you know, the story that is up?
It took some work. Special thanks to a lot of the comms teams at Spectrum and Mercy Health and University of Michigan Health West. Apologies to Jamie. And they were great as far as trying to get me all the information I was asking for and trying to get into some of the specifics. It's not the easiest thing in the world to hammer out, but they were able to do it for me. And that's a good point that you made. So the fall of 2020, when that spike was 365, that was before the vaccine had come out. So the Delta Omicron spike, Spectrum hit 421 as their peak, 421 hospitalized patients in December of 2021. And about, I would estimate 80 to 85% of those are just in the Grand Rapids hospitals alone. So 421 is across their entire network. That includes their hospitals towards the south end of the state and up in further into northwest Michigan. But I would say 80 to 85% of those cases were right here just in Butterworth, Blodgett. So
I guess one of the things now to kind of move forward and move on to that next one, which these are all stems of one another, is the big question of what's next. And that was an article that went there that's live on woodtv.com. That went on up on the 8th, I believe that was 2 days ago, Tuesday. Yep. What was that one?
So that one we tried to ask a lot of the questions that we felt our viewers would have. Like, okay, we're hitting this milestone. Today marks 2 years since Michigan found their first COVID cases, confirmed COVID cases. So what's next? Our cases and hospitalizations, thankfully, are dropping dramatically. I know our healthcare workers are ecstatic about that. So are we nearing an end of the pandemic? What does the end look like? One of the epidemiologists I talked to says she's hopeful that we're entering what would be called an endemic stage. Maybe COVID moves to a more seasonal virus. And we also talked about the vaccines. So obviously with the Omicron variant, the vaccines that Pfizer and Moderna and those companies have developed were extremely effective against the original strain of the Delta variant, much less so against Omicron, to the point where we saw a lot of breakthrough cases and even in some cases breakthrough hospitalizations. But the numbers did show that even though we're seeing a lot of breakthrough cases with Omicron, I think it was 17% times less likely to be in the hospital from vaccinated to unvaccinated with the Omicron variant. But the question is, we know the virus is mutating, and when there's a lot of cases and outbreaks, that gives the virus more chance to mutate and possibly develop a strain that our vaccines don't protect against, or strains that are much more deadly, have much more severe consequences. So can we stay on top of those things? That epidemiologist I talked to from the University of Michigan seemed hopeful. Could we see something more like we see with the annual flu shot, where they are tracking active strains of COVID, seeing what is popular in each community, and try to address that? Can we see vaccines going forward where they have formulas for multiple COVID strains, like not just something that is specifically for, let's say, Delta or Omicron or BA2, which is the next variant that health experts are tracking? If we can just try to estimate and try to come up with a seasonal vaccine as far as this is what would offer the best protection.
And then moving on to a story that just went live on woodtv.com yesterday is focusing in on one specific nurse here. This one titled "How Did I Tolerate That?" Nurse reflects on decision to leave COVID-19 unit. A nurse from Butterworth. Tell us about her. Tell us about that story.
Yeah, her name is Bobby Jo Whitefield. She's been at Butterworth for about 20 years now. And she was kind enough to share her story with me. Before the pandemic, she worked on an inpatient floor, so she's dealing with patients that have been admitted to the hospital, but they're not in intensive care. So it's a non-ICU inpatient unit. It's called 9 Center. When the pandemic hit, 9 Center became Butterworth's non-ICU COVID unit. So they're exclusively treating COVID patients, not ones that are that need to be in intensive care, but ones that obviously still need help, still need to be in the hospital. And she talked about the mental stress of it all, working a lot of long hours when the pandemic first started, because so much was unknown, the fear of the virus. She talked about how she actually contracted COVID early on, late April 2020. She first got sick, and she talked about how her sister called her once she heard the news and was just sobbing because she thought that meant she was going to die. We're at a point where there was such little known about this virus, how it spread, and what it meant. That, some people kind of felt like they were walking a line between life and death. So it's a lot of stress to be put in that position, to be caring for these people while handling a potentially deadly virus. She talked about how when the pandemic first started, 9 Center was fully staffed in a great place, but so many staff on that floor just were so worn down that they left. There's a study out that says 1 in 5 people in the healthcare industry since the pandemic started have left their job. So either they had to tap out from the stress. And Bobby Jo's was eventually, for her own sake, she eventually left that unit. She moved to a different unit in the hospital that doesn't handle COVID patients, where she said, it feels more normal to her. She says her energy's back. She feels like a nurse again. But she couldn't handle that mental and emotional baggage anymore. She also talked about all the abuse she saw. It was kind of disturbing. We've heard a lot of stories about health officials being threatened. We've heard stories of violence for our healthcare workers, and that stuff was really disheartening to hear. She talked about, when you have patients in her unit, her quote was, they have a door, and they have a window, and that's it. They can't, for most of the time, they couldn't have visitors, so the only people they could take their frustrations out on was them. So she would get hit with bags of urine or vomit. She said one of her coworkers had a cup of hot coffee thrown at her. Because of the visiting policy, one of the patient's mothers called her, found out her last name and threatened to kill her if something would happen to her daughter because the mother wasn't allowed to come visit the hospital. So it's these kind of things that have really worn out a lot of our healthcare workers.
And that burnout is we just hear it over and over again, especially within healthcare over the duration of the pandemic there. Well, moving on to a story now, ladies and gentlemen. This one is actually the one that is attached to the article, as I mentioned earlier, for those of you just tuning in here with these series of stories from digital reporter Matt Jaworski here. Matt, frontliners mark 2 years of stress and tears, going along the same lines of the story you just shared about a healthcare worker here in West Michigan. What about this one here?
Yeah, this was a really fun story to do. So we set up a round table. So we got healthcare workers from the 3 main hospitals here in Grand Rapids and their hospital systems. So Spectrum, Mercy Health, St. Mary's, and then U of M Health West. And it was really interesting. So we brought all 5 of them into the studio, just kind of hear their stories, what it was like when they first heard the news that COVID cases were finally found here in Michigan, the stress of working through those surges and the long hours, facing abuse, and really being put in the position where they had to care for people that were working actively against some of the steps we were trying to take to prevent more of the virus spread. One of the doctors, Dr. Pedraza, he's the director of critical care from U of M Health West. And this is in the piece, he talked about there was a man who came in, was in his 50s, fairly healthy. His statement was he had a little bit of diabetes, but was otherwise healthy. He came in with COVID and was on a high amount of oxygen. And so just in the course of, they have to admit patients, they have to learn their medical information. He asked if they were he was vaccinated. He said no, and his wife was adamantly like, and we're not going to get vaccinated. And Dr. Pedraza was like, I mean, that's your decision. He wasn't pushing anything on them. But he had to ask. Eventually, that man was admitted to the ICU. A couple days later, he had to be put on a ventilator. And before they put the man on the vent, he asked a nurse, like, go get the man's cell phone, let him call his wife, because this is very likely going to be the last time they talk. And he did, and Dr. Pedraza, that was the one time he kind of pushed on him. He's like, I don't care about your politics or anything or why you made the decision you do. I would just ask to please tell your family to consider getting vaccinated. And Dr. Pedraza said the man refused to do it. He made his phone call, he hung up, and he died about a week later, never came off the vent. So it's just these are the kind of stories that all of our healthcare workers have. And it's the added emotional and mental stress of just constantly being surrounded by this. I mean, they can go home and try to take their mind off of things, but they can't escape from it. So there was a study published by the U.S. News and World Report. So healthcare workers are already at a higher likelihood to reach career burnout where they just can't handle the job anymore and they've got to leave the sector. That's up much higher now during the pandemic. They have an estimate between 60 and 75% of our healthcare workers said they struggle with some form of depression, PTSD, a sleep disorder, or dealing with suicidal thoughts. I mean, that's up to 3/4 of our health professionals. It's a jarring number.
And then looking forward to, we have one more story here to round out the week. What are we looking at tomorrow morning? This will go live tomorrow. I am looking at so in these last 2 years, there's a healthy segment of our population that has lost a lot of faith in our public health officials. So I reached out to just our departments here in West Michigan. Obviously, Adam London, Kent County's health administrator, has dealt with a lot of blowback and animosity, people wanting him off the job. Other departments have lost funding because people on the board have been frustrated with their actions, whether it was keeping mask mandates in place or other things. So of all the departments in West Michigan, our 13 counties, what we consider our demo here at Wood TV, none of them wanted to talk, and understandably to a point. I mean, there's a lot of just viciousness out there. They don't want to stir the pot any more than they necessarily have to when they're putting out these health orders for the sake of trying to keep the community safe.
However, I did talk to Lisa Peacock. She is a health director in northern Michigan for 6 counties up there, including Benzie County, the Grand Traverse area, as well as the president of the Michigan Association of Local Public Health Officials. So they talked about just these last 2 years and dealing with that animosity. I know Lisa, she goes on to talk about how she kind of felt like in her area she was the public face for all of this. So even early on in the pandemic, when Governor Whitmer and the state health department are putting these orders in place, whether it's shutting down restaurants or just putting restrictions in place to try to prevent spreading the virus, she felt like she was the public face of it, because there are people, like, they're not going to get face-to-face time with the governor necessarily or the state health director, but they will see her pumping gas, or they'll see her at the school board meeting or whatever, and so she takes the brunt of that. So she went on and talks about, her mental health and the threats that she's faced, and calling police and people calling for her to be fired from her job, that kind of stuff, and the toll that it took on them.
And what time can we expect to see that on woodtv.com?
So that'll come out bright and early tomorrow morning. I know we'll have sound of that on daybreak, so when you wake up tomorrow morning, it'll be there.
Perfect. Matt Jaworski, ladies and gentlemen. Matt, thanks for taking some time to tell us about these stories, these series of stories here. Again, folks, for those of you maybe just tuning in, or if you tuned in halfway, that story that went live this morning is attached to the stream. It'll take you over to woodtv.com. You'll be able to find all of them there. I'm News 8 digital anchor Luke Lasser. This has been a look at the Wood TV Live Desk, folks. Have a great afternoon, and we'll see you around. Thanks.